attention is fundamental to everything that our brain does. And there's so many different types of attention. I could easily talk an hour about attention, all the different times, top down and bottom up, sustained attention, selective attention, and it's just infinitely fascinating.
That little nugget of wisdom was from my dear friend Adam Gazzaley. Adam is a neuroscientist, an author, an inventor, founder of Neuroscape, which is a research center at UCSF. And in this episode, we talk about attention, one of the few precious things that we have in this world, and how we direct it actually results in the experience of our life. How mental health now has new digital medicine where you can actually play video games to improve your mental health, and then the brain's ability to change and grow over time through neuroplasticity. It's an amazing episode. Yours truly with Dr. Adam Gazzaley. They love you. Dr. Adam Gazzaley is back in the house after a 5-year hiatus. Good doctor, welcome back to the show. Congratulations on all your success since the last time we talked. What a ride it's been. Welcome back.
Thank you. It's great to be back. It's great to see your face again. After so long, the world's been flipped upside down, turned inside out, and it feels good to be connecting again.
Oh, indeed. In preparation for our conversation today, I was reviewing the last time you were on the show, which was some 5 years ago.
Mm.
And I was also scrolling through my phone, looking back at photographs of your lab at UCSF. And for those who might not be familiar with you and your work, I'd love to start out today's show with you just giving again, I'll do the fancy intro later, but just give us, orient us in the world that you work and live in, and help us understand, in your own words, why you'd be a guest on the show here.
Sure. Well, I wear a lot of hats, so I'll try to break it down. Two main hats that we'll probably spend our time talking about are my academic hat and my industry side. So as an academic, I am an MD, PhD. I'm a full-time professor here at University of California, San Francisco, where I'm talking to you now. I run a research center that used to be my lab. Now it's become a center called Neuroscape. We're probably transitioning around the last time we talked, 2017. And we do some really what I think is interesting and hopefully important work on the intersection of technology and neuroscience, to translate neuroscience beyond the laboratory into people's lives and to have tools for us to better understand our brains and better improve our brain function. So that's on one side. On the other side, I'm a co-founder and board member and science advisor for a company called Achille. And Achille is a company that is distributing, first developing, validating, and now delivering a unique digital video game medicine that was originally designed by myself and developed and validated at UCSF, and now is with the company and is going out as we speak as a very unique treatment for children with ADHD. So that's a little bit of the high level.
And let me translate that for the rest of us. Adam has a very large brain, and and he puts it to use doing very, very interesting things. I have long been fascinated with neuroscience and the intersection of neurology, our experience of life. And I think we were originally introduced back at your lab, and I remember touring it when a lot of this stuff was, I would call it, sort of in production and
Mhm.
hadn't been fully, hadn't seen the market yet. And
Sure.
I remember hearing, you'd founded Achille. You said this was 5 years ago. You've recently gone public, so again, congratulations on that.
Yep.
I mean, that was a 14-year journey, as I understand it, and
Correct.
this vision of 14 years ago, having ostensibly video games as a form of medication, which is now recognized and validated by the FDA. Can you help us understand the A, sort of the applications, and B, how help us wrap our mind around the future of digital medicine?
Yeah. There's so much there. Definitely more than we'll probably cover in this time, but I'm happy to start dipping into that.
Sure.
And
Yeah, of
you
course.
did mention 14 years ago, which always makes me sort of project myself back into time where I was on this campus, not actually in this building, which wasn't built then, but on this campus at UCSF. And I would say the idea that drove me 14 years ago in 2008 was really one out of need and one out of what I thought was opportunity. And the need was that we have been doing what I think is a pretty horrendous job. And by we, I mean like our whole species, like the human kind, in terms of supporting and enhancing human cognition, broadly defined. In the case in 2008, what I was mostly focusing on was attention. And that's because my research was focused on attention. And I was focused on attention in older adults. And my research showed that as we get older, and older basically meaning older than 23 years old, we're not able to deploy our attentional abilities the way we were when we were younger. And this has a whole host of consequences on how we interact with the world and live our lives. And we didn't really have a solution for it. And so that was my particular interest. But the bigger problem is broader than that. When it comes to depression, stress regulation, mood regulation in general, memory, perception, how we feel empathy, compassion. I mean, this is what sort of evolved over the years. We're really lacking in tools to improve those things. And in terms of opportunity, as a neurologist, when we think about how might we improve these capacities of our mind so that we could live better lives, we tend to think, where's the drug for that? Because that's what medicine is. Like when I went to medical school, is basically medicine equals drug. And so, which is the drug that turns on memory and stops trauma from PTSD? And we don't really have those drugs, right? We have reasonable things that manage symptoms in some people, but our what I call a cognition crisis that I think we're facing globally is getting worse, right? While you see improvements in things like oncology and even infectious disease, despite the fact of the pandemic, which we actually managed incredibly well globally, considering how quickly we were able to generate vaccines. But when it comes to medicines for the mind, we just don't really have great solutions. And we see the pandemic has just aggravated that, especially in children and seniors. But 14 years ago, obviously that didn't happen. I was still quite alarmed by the lack of tools that we have as physicians in helping patients that are suffering all these conditions of the mind. And so on the opportunity side, it was what I was interested in was thinking beyond the pill. How could we harness the fact that our brain has this property known as neuroplasticity, meaning it changes itself, its structure, its chemistry, its function, every aspect of its physiology and functioning based upon its interactions with the world experience. And so the idea was, can we deliver an experience in a targeted and personalized way to an individual such that we can improve their attention abilities? And if you're thinking about delivering an experience, can we do it digitally so that it's more accessible, more adaptable? And if you're thinking about a digital experience and you want someone to engage in it deeply and for a long period of time, I was thinking about a video game, right? We want fun, we want enjoyment, we want play. And so that was like the beginning of the idea. And, fast forward 14 years later, we built that game first here at UCSF and ran a series of sort of foundational studies on it and published it in Nature. We've talked about this last time, and that's a cover of Nature, which was where we were in 2013. It's like the cover of Rolling Stones for my musician friends, and it was an incredibly exciting moment. And not that we said, "Here we go, we have a solution for you, world." It was that we have a signal that we were able to develop something quite unique as a video game and show that we can improve cognitive abilities outside of the game. But it was just the beginning. First of all, the game was essentially a prototype of a game. It was nothing, I mean, it was great for a lab to build, but it was nothing that people would actually want to play for any amount of time. And the level of validation was still very small, even though it was in Nature. It was a small, and it was a very focused population of older adults, and there was a lot of work to be done. And so over the years, I've been trying to move this technology and these discoveries outside of the laboratory into industry, because to truly translate, you can't just keep it locked in academics. It's just not what academics is good for. We don't scale products to get it to people. And then over the last decade, Achille has been making a way better game, preserving the underlying game engine, because that is the active ingredient of our game, and it's defined by a patent, which really describes the methodology. So that's critical. That's like, the from the pharmaceutical world, like the active ingredient, the molecule version of the interactive experience. But around that, we can build art, music, story, characters, feedback, reward cycles, all the things that make games so wonderful. And so a lot of Achilles been building an amazing game experience. And then the other side has been supporting multiple research trials. And as a company with a game that we know targets attention abilities, we were a startup. You have to be focused. You can't help everyone. The FDA only gives indications for very narrow clinical populations. They don't say, here's something that the FDA is going to prove for attention in anyone that's suffering attention. I wish that was true. That is not the case. So you have to pick very precisely and then do a multiple year, multi site, double blind, randomized control trial to show that you hit your predefined endpoints. It's like a baseball player, like calling, I'm going to hit a home run right now, and then doing it, right? You have to call it up front. We did that, and the population we selected was children with ADHD, for lots of reasons. It's a population in great need. A lot of parents and kids do not want to be on the current medication, which are stimulants largely. And so that was our target population. Our trial was successful. We submitted it to the FDA for approval as a class 2 medical device to treat this population. And since we last talked in 2020, so like right in the heart of COVID, the FDA cleared this for treatment for children as a medical device. And so essentially it is the first ever FDA approved video game for any medical condition. In this case, it happens to be for ADHD. And then over the last couple of years, we've been exploring how do we now deliver a completely new type of medicine to children, that they download on their devices. And we're wrapping up what I guess I'd call a soft launch. And now launching this quarter for real. But we already have many children who are not participants in research studies, but are actually playing their medicine right now. And I've talked to these kids, and it's just an amazing time for us. So that's a little summary of the last 14 years. And since we talked, as fast as I can do it.
Dude, genius, like a laser beams. Thank you so much. That's as accurate as you have to be with the FDA on proposing a trial. Um, okay, there are three circles that I just was drawing in my mind. One, a very practical one. The second one is for what you've just laid out there, I think is fascinating for potential sufferers or our, they'll just call it attention, whether
Mhm,
that's attention deficit or how we direct our attention.
mhm,
And then there's the brain piece, our neuroplasticity,
mhm,
like what implications that you have come to understand
mhm.
as a leading scientist in the field. So I want to explore all of those. And
Sure.
it was amazing to have you outline that. I got like a few notes here that I'm referring to, and it was in reverse order from what I just articulated. But I want to tackle each of those in that order. So let's tackle this idea of, so what you just said is there are kids playing video games right now that is targeting uh, helping their attention deficit disorder.
Correct.
If you're a parent or a person who suffers from that right now, the very practical question is, oh my God, how do I get some of this? Because right now I'm eating Adderall by the handful, or I don't want to give my kid this, or I want to, explore things on the cusp of the future of medicine around the conditions that affect me and my family, for example. So let's go practical at first. How?
Yeah.
How do you get involved in this?
You talk to your doctor. That's it's the company and myself. We have several goals, as well as Neuroscape is not just a new product, or a new company, but a new field, a new type of medicine, a new way of thinking about medicine. So just like a parent might bring their child to the pediatrician and say, "My kid's suffering in school. The teacher's like, something's up, and we should get an evaluation." They get an evaluation like, "Your child has ADHD. By these diagnostic criteria, they fit into this category." Let's say it's inattentive or combined ADHD. ADHD has like three sort of buckets: hyperactive, inattentive, or combined. More people than not have a bit of both. Our treatment is indicated for right now for 8 to 12-year-olds with inattentive or combined ADHD. And so the doctor then basically writes a prescription, and you get a code to download it on your device, on your own device, and then you play your medical treatment for a month. A dose of our medicine is a month, and that's around 25 minutes a day, 5 days a week for those 4 weeks. So that is the practical aspect of how you get it. We are currently in research studies to increase the age range of that indication.
That was my
As I
next
mentioned, you
question.
have to
Yep.
be very narrow with the FDA. It's the reality, and so essentially that was our phase 3 clinical trial population with 8 to 12-year-olds. We have lots of data that this has benefits in many other populations, not just within ADHD, but depression, autism, multiple sclerosis. We have new studies in COVID fog. Basically, any population that has attention deficits, which is pretty much all of them, and you might even say beyond clinical diagnosis, we're all suffering a bit of attention deficits. Our data suggests that it will have benefit, but now we have to go through that highest level of randomized controlled trial to take that to the FDA to expand the indication. But if you're a mom of a child or a dad of a child or a child that's hearing this, that a friend at school is doing this, the pathway is to go to your doctor and you get a prescription just like you would for Adderall.
Wow. I imagine there are a number of people who are listening to this or watching right now that are scrambling to get a hold of their doctor because just even the promise, the concept of something being so different. How would you categorize this on the level of affect or invasiveness? Because clearly that was had to be one of your interests early on, like putting kids on stimulants,
Oh,
sure, if it
yeah.
can mask some of the systems or the symptoms, but like, do you have any evidence about, why this is so much better than pumping our kids, like playing medicine rather than taking it, for
Yeah,
example?
I mean, I think there's lots of reasons. One of them is that the changes that are induced by this treatment are targeting brain networks through the process of neuroplasticity, which our data already suggests can lead to enduring change, actually like a change in the underlying systems that are causing these challenges in the world around you. We're still investigating how long they could be sustained when you need a booster. I mean,
Mhm.
neuroplasticity is somewhat analogous to the changes that occur in your physical body when you exercise. And as we all know, you can have an exercise program, whether it be cardio or weight training, and you get gains gradually through work, just like this game. It's fun, but it is work. And then it lasts a while. And maybe you could do things in your regular daily life to help prolong that. Even if you stop going to the gym, you might start saying, well, I'm going to take the stairs now or walk to work. But you may also need a boost of that. And so we're experimenting and understanding through research how and when people need to get more doses of it. So that's one thing that's different. Stimulants work when you're taking them. And then when you stop taking them, they're not working. So they're not really leading to that change. And the data is quite, um, revealing of that. The other thing is that there are lots of side effects with current medications across the board. In this particular condition, stimulants are tolerated well by some, but not by many. Being on basically a drug that alters your neurotransmitters and your neurochemistry for a long time, like this is certainly a chronic treatment. We don't fully understand what that means for neurodevelopment and for outcomes. And so we're offering a solution that doesn't have that side effect profile. Now, so we have no serious side effects in our studies. Maybe that's surprising to people, maybe it's not. Video games are complicated in lots of ways, like everything's complicated. There's always good and bad. Part of, I think, what is important about our treatment is that it's very time limited. You don't play this game all day long. You play it for 25 minutes. The game will not allow you to play it for longer than that in a day. It won't allow you to play it for more than 5 days a week. This is how we control overdosing of our medication, because overdosing can occur for any medication. And so that's another advantage, is that we can control the dose easier than someone with a case of pills. We don't have no side effects. Our side effects, however, usually fall in the category of frustration, which is quite modest compared to the status quo side effects. But It's there. The game is hard. It's fun. We build a lot of reward and avatar adjustment, and it's a delightful game in many ways. But it is a workout for your brain, and kids feel it. And some headaches, but for the most part, it's really minor or no side effects. So that's another advantage. I'd say another advantage is that once you have this treatment in your hands, we have a connection with you through your devices. And so we can do other testing and feedback, unlike a lot of medications where you're sort of disconnected once you take that bottle of pills home and you have to go back to your doctor to know what's happening. We have this closed loop system where data is flowing from you into the device and back, and we can record and ask your parents things. So we're building out that other part of the system where it's like a full care system. So because of the data nature of this treatment, we have an opportunity to give a lot more than just the treatment. We could give feedback and do other testing. So all of these things are what makes us so excited about this as a new type of medicine.
So, of these circles that I just sort of laid out there, one last follow up on that first circle is you've spoken and been the inventor of this very particular medicine that is sort of like a land and expand strategy in business, right? You want to get there, and then you want to expand the ages. And again, all this 360-degree approach and learning will certainly lead to further developments and sounds very encouraging to grow and and develop further. Give us your take more broadly, zoom out within the same circle around just digital medicine, because even
Mhm.
the concept of digital medicine, I think some people are thinking, oh, you mean I get my records in the charm portal and I go to type in my password and I get a text message from my doctor, and it's like
Mhm.
that's not really what we're talking about with digital medicine. So can you just in a sense to draw a exciting vector for the future for people who don't actually live in your world?
Yeah,
Where
it's a
is
great
where is digital medicine going?
Yeah, it's a great question because the term is not incredibly well defined. I mean, I've used it over the years myself, and it could be viewed really broadly that it's everything from digital record keeping to telemedicine to at home diagnostics using devices to therapeutic treatments that use digital technologies to deliver them. I'd say it's not unreasonable to think of all that in the scope of this. Some would be a little more precise and say this is a digital therapeutic, focusing on the role of this particular device as a treatment and not just a diagnostic or recording tool. And so that is a little bit more specific. I I use a different term now to describe what this is over the years of having been working on this for so long. I tend to think that the digital and even the video game are really important. They're exciting, but they are the delivery tool. The real medicine is the experience, and that is a well-founded principle called experience-dependent plasticity in neuroscience. It's the basis of all learning is that experience drives plasticity. So the video game and the digital technologies are a tool. In some ways, they're like our pill, right? They're the delivery system of the experience, but it's the experience that changes you. And so that's the opportunity. How do we use all this amazing technology that is now accessible to people in the world that might not have access to doctors or teachers, or might not live near a medical center where they can see the best, experts in the world? How can we use the fact that digital technology is becoming so much more affordable, pervasive? Wi-Fi is soon to be everywhere. How do we, and also all the massive advances in machine learning and cloud-based analytics and big data, like all of these things have not really been harnessed to deliver better medicine for the mind, and we're suffering because of it. So that's really the promise. How do we use the digital technologies to then bring experiences to people that are delightful and engaging and enjoyable, and medicine is fun but leads to these meaningful and enduring outcomes? That's the vision.
God, so exciting. It feels like it's like a step function change, right? It's even if you just talk about, okay, so I have to go physically to this doctor, if I can get an appointment
Hmm.
and I have to wait in the room and then I have to go in there and I have spent, 45 minutes with this person over the 20-year relationship that we've had with this person, and they poke you and they stick some things on your face and in your ear, and then they give you a piece of paper, and then you drive across town
Hmm.
and you get a plastic bottle,
Hmm.
an orange plastic bottle full of pills. I mean, just that versus the picture that you painted around playing your medicine on your device. It's time limited, it's constrained. You can limit for overdoses. You're aware if you're not actually taking it. There's the feedback loop is virtually instantaneous. There's
Hmm.
reporting, there's analytics in real
Hmm.
time. Like
Hmm.
they just sound like completely different universes. How exciting.
It's so exciting. I mean, to me, you could, I mean, I even had chills just you
I
recounting it
I
back to
I
me.
did I did too. I did too. It's like my hair on my arms is standing up and I'm like,
Yeah, it's what I think it's sort of what we all dream technology would do. It's like, the a little bit of the science fiction view of what the gateway and opportunities and potential that all of these devices and software and communication and entertainment products like allow us to accomplish, but it just has not happened, and it's not happened at all. And the technology is there and the research is there and a neuroscience understanding is there. Now it takes a lot of shifts and essentially in the paradigm of medicine. This
mhm,
is a really very different way of thinking about medicine, and that is a lot of why we you know this company was formed 10 years ago. We're just starting to generate revenue now and really just launching now. So why spend 10 years when you could build a video game and just put it out there, as quick as possible and just say, here's another app? Because we really do want to make a paradigm shift of what everyone thinks about medicine, from the parents to the patients themselves, to the doctors, to the regulatory agencies, to the insurance companies. Like, there's a lot of stakeholders here, and it's a complicated process to change an institutional structure and a multi-billion-dollar industry of the pharma industry, maybe $1 trillion, that we've been sort of embedded in before we were born, Chase. I mean, this is just a system that's been going on, and now we're like, well, here's another system, and we don't want you to think about this as alternative. That's not cool, right? Like, it sounds fun and edgy, but like, alternative means that most people do not have access to it. We want mainstream medicine. This should just be standard medical treatment. And um, as you said, you have to start focused as a business, as a startup, as a new product, a new category in medicine. This was a de novo approval by the FDA, meaning that there is no predicate. There's nothing that we relied on to get this approval. We had to start from scratch. It's a long process, but now we have a beachhead. We will have data, real world data, not just randomized control trial data, real world data of children taking this medicine over the next couple of years, where we could see all the positive benefits that it has in their lives, and how we can really scale this up and really address all this need. But it is just the beginning, and not just for Achille, but many, many other companies out there that I talk to all the time. Many of them are watching Achille, because it's hard work and it's long, and they're like, okay, if you pass these hurdles, which we are, and we still have some in front of us, then we're in here. And there's other things like virtual reality and other conditions and other types of games and even non-games. So it's just the beginning of a whole new field, but it is immensely exciting.
all right, we're gonna put a pin in that because that is a big thing to marinate on, and it is so exciting, and this is part of why, again, I wanted to have you back on the show because it's in just 5 years, it's come a long ways, and now
It
it's
has.
actually happening,
It's actually
and
happening.
yeah, and as a vector for the future, this, as you said, a beachhead, it sort of signals hope and a new paradigm in a world that frankly could use a new paradigm shift. I mean, we used to place leeches on people's faces. And then and before we did the whole doctor thing, or if you're
Hmm.
watching Game of Thrones or
Hmm.
Return of the Dragon, you see the doctors taking care of people, and then it's this relationship that you don't have in the or the orange bottle of pills. And the future sounds so much more exciting than either of those. So
Thank you.
So congratulations again to put a pin in that. Now I want to direct our attention to this other that was a double entendre accidentally there. This other circle that I sort of had it going in my mind as you were sharing your background and your opening salvo there. And this is the concept of attention.
Mm,
Now, I will take 60 seconds and describe my fascination with attention. I'll say mine and my wife's. My wife has been studying attention through Eastern
mm,
traditions for a long time. She studied
mhm,
with Ram Dass,
mm, mhm,
and just the other night we were with Eckhart Tolle.
mhm,
This is an Eastern tradition of how you are able to direct your attention. And I'll say mine and my wife's beliefs, I've drafted off her largely, but it's when you really boil it down, all we have in this life, all we have is our attention. How we direct our attention has direct consequences on how we experience the world. If you're looking at how beautiful the tree out the window is, placing your attention on this gently moving leaves and the light filtering through them and how beautiful that is, you will have one experience. And if you think about the state of the world in a pandemic, political upheaval, war, you're directing your attention to something else, then you will have a very different experience. So
mhm,
at a super fundamental level, my belief is that attention and where you're placing your attention, there's no such thing as the future. That
mhm,
is not a real thing. In the past, gone. All we
mhm,
have is attention in this moment.
mhm,
So you are working, again, selfishly wanted to have you back on the show because I'm obsessed with attention. You have chosen to focus attention here, and you explicated very clearly why you chose, people with attention deficit and the age group. But I got a hunch that you care about attention more broadly.
mhm,
So I just gave you this sort of
mhm,
laundry list or my baggage, if you will,
mhm.
carrying into attention. Can you share me what yours is with me? What yours is like? How do you think about attention and why it clearly matters to you because of all the shit in the world to study?
Yeah.
You chose attention.
Yes.
Why?
Well, you said it perfectly. So that saves me at least 60 seconds of not just echoing what you said. Although I will highlight it that from a neuroscience perspective, I've been doing neuroscience research for 30 years now, that attention is fundamental to everything that our brain does. And there's so many different types of attention. I could easily talk an hour about attention, all the different times, top down and bottom up, sustained attention, selective attention, and it's just infinitely fascinating how you move attention and how you divide attention. I mean, it's really an incredibly fascinating topic. We're learning a lot about how it works from a neural perspective, with human cognitive neuroscience research, both functional imaging and other sophisticated ways of challenging people and seeing how their attention either fragments or steadies. But what you described is really, completely consistent with my view that how we paint the world in our minds, how we perceive, is guided by our attention, how we deploy it. And that then creates our memories and forms our personality and our, emotional landscape, our ability to make decisions, the way that we care about each other and ourselves, the way we think about the future. All of it is driven by attention. And there are many forces in the world that are actually, somewhat designed to direct your attention to them and thus fragment your attention from what you may have wanted to direct it to. And so our modern world is not the world that our brains evolved in. And we have developed a set of attentional systems to interact with the world that is very different from the current world. And so it makes perfect sense why many people are struggling with attention right now, not just children with ADHD, but essentially everyone to some degree. Um, I wrote a whole book on this topic, The Distracted Mind, and really an evolutionary perspective, ancient brains in a high-tech world. And I wrote a lot of the neuroscience, and my colleague Larry Rosen, who's a psychologist who really works in the field, at like how kids' attentions are really being impacted by their interactions with digital media, really tried to paint a big picture. And so, just to summarize, attention is critical for how we perform, how we live, how we think, how we feel. And when it is pathologically impacted by some condition, and I would say that every single neurological or psychiatric condition that impacts your brain diminishes your attentional ability. All of them. I'd love someone to call me out on one that doesn't, because I just don't think there is. You could just basically put the condition in PubMed or Google Scholar and then put the word attention, and you will find articles showing that people with that condition are suffering attention deficits. And that's because attention is a widespread network phenomena of our brain. And so if there's an insult or challenge anywhere in your brain, it'll diminish attention. And so once you have attention not being deployed at its highest level, there's a cascade of negative consequences that reach across your entire life. Maybe how you're functioning at work, how you sleep, how you interact with the people you love, the level of performance that you're able to attain in anything, whether it's your health or your interactions with your employees or your coworkers. And so to me, improving attention is like the base of the pyramid, right? Like all these other important blocks, memory, decision making, emotional regulation, empathy, compassion, imagination, creativity, all sitting on top of that attentional foundation. So if we could build a better foundation, we could make a better brain and make a better life for us.
Mm. Okay. So two other pieces in this circle. One piece you said in probably the most scientifically appropriate way that there are other things that are competing for our attention and directing it. You said it in such a way that did not imply any nefarious sort of underpinnings, but I know that that is the scientist in you. I believe that is a scientist in you. I will therefore take the position of there are things that suck, that are tearing our attention to pieces in the modern world, and they're using this sort of combination of psychology and the understanding of our attention to almost weaponizing it. Sounds a little bit aggressive because that only implies nefarious. I think there's they want to make their product successful, and so they want to attract your attention and hold your attention and sell either your attention or sell you a product that you are consuming with your attention. What are you scared for this? Is this as a big a deal as we think it is, and is that one of the reasons you're working here?
Yeah, I think it is a big deal. And, as I said, this is not the environment that our brains evolved in. We did not have, I mean, look, we always had distracting elements, right? You might be foraging in the field and a predator, that's like the classic that all animals face, is like your attention is divided, but it's like to save your life, or, there just wasn't as many information streams that were so cleverly directed at pulling you. And so we have a challenge. Our species has a challenge now, is how do we value this ability to have control over how, where, and when we deploy our attention, and how do we regain that control? And there's some ancient, traditions, like you described, that meditation is really attention training. If you really want to, I mean, there's so many things it is, and I'm a big fan. And Jack Cornfield is a collaborator of mine and a dear friend, and we've worked together on projects. We've worked on a paper together, and I really, see the incredible value beyond attention. But at its core, when you start with concentrated breath focused meditation, it's an attention exercise, because you can't even go further to like meta and loving kindness and other aspects that mindfulness practices can deliver to you if you can focus your attention, right? So
Yeah.
it's like building block number one. And so, for thousands of years, we've clearly known that this was a key part of what needs to be done in order to live a high quality life, nevertheless an enlightened life, or even a life free of suffering. And that was before we've had social media, right? It was always there that there was some value around the world. Many cultures have independently arrived at their own approaches to achieving practices of attention. And so, yeah, I am worried about how things are now. I'm especially worried with children, and not just children themselves, but even how parents interact with children. And so I think that this needs to be valued more, and we need to have clever approaches, both behavioral approaches of how we interact with our digital worlds, and then hopefully new solutions like what we're working on at Neuroscape and Achille to actually flip the story around and show how digital technology, when thoughtfully designed, rigorously validated, and then, deployed in a responsible way, can actually lead to an enhancement of what makes us human. That's the goal. That's my dream of technology, is that it is really an enhancement technology, not just an offloading or a distraction, but a way that we can evolve our minds. That's the dream.
Mm. Well, thank you for going to that place around, uh, Jack. I mentioned my wife, Kate.
Hmm.
Kate studied with Jack and Tara, and
Hmm.
done their, done, learned under their tutelage, and all of that is so impressive. My own experience in life has, as a 10-year meditator, um, has given me that empirical experience. Do you feel like that is, um, I guess, how do you manage this line between being a neuroscientist and MD, PhD, understanding there are like very clearly scientifically proven benefits to meditation,
Hmm.
and as you said, it's essentially training your attention.
Hmm.
Whether you move the attention when it wanders, because not it's if it wanders, it's when it wanders.
Hmm.
You bring it back
Undoubtedly.
to the bring it back to the breath, or
Hmm.
bring it back to the mantra or whatever it is.
Hmm.
Um, do you believe in it? And can you sort of, I'm not looking for you to cite a bunch of studies here, but um, give us your 2 cents on that for people who either are meditating and need a little bit of validation, or who don't understand that it has scientifically validated benefits that you can or can't. If you can't attest to it, don't.
Yeah,
But
I feel really comfortable talking about this now, more so than I did in 2017, because since then, so remember, like I'm wearing two hats here, and could be
mm,
confusing. So I am the founder of Achille, and Achille has one product focused on ADHD to improve attention abilities in these children. It will be expanding. That is a major part of my life. I am the inventor of that technology. I'm, part of that company since its foundation. Super excited about it. My day job actually is working 100, I'm 100% professor at UCSF running Neuroscape. And at Neuroscape, we don't have one technology. We don't focus on one population. We are really trying to push the envelope of this idea of experiential medicine delivered by digital technologies. And so we have many, many games, some of them, and they all really have in common in that I looked at real world experiences that have tons of data, even thousands of years of data, showing that they have benefits on us, and then saying, can we find some active ingredient there that we could put into a closed loop, meaning an adaptive, personalized digital technology, and then run a careful research study and show that it can improve performance, and then record brain activity and show how it can and why. Basically, what we did with NeuroRacer that became Endeavor. One of them uses physical fitness, motion capture, physiological heart recordings. We just had a paper in Nature Aging showing that benefited attention in older adults. We have another paper that's coming out in a couple of weeks. There'll be some good press around that, showing that rhythm and a music game that we created with collaborators like Mickey Hart from the Grateful Dead lead to benefits in working memory. We have another paper coming out with that same, a different version of the game, showing that it improves reading in children. And we have a game that takes place in virtual reality called Labyrinth that we had a paper since we last talked that shows that it improves memory abilities in older adults. They navigate a 3D landscape that keeps getting more complicated as they manage to find their way through it. And then we have a game called Metatrain. So that was like a long buildup because I wanted to
Yeah, I
show
love it.
you all the things that are going on that I'm so excited about. None of these are with a company or are products. These are research studies, but these are the seeds that I think will be the future of experiential medicine once we get Achilles through its path with this first product. But at Neuroscape, we have all these, and Metatrain is a project that I started 7 years ago with Jack Cornfield. I had an idea. We were introduced. I presented it to him. I was super nervous that he was going to think that this was like totally inappropriate, disrespectful to the ancient traditions of meditation practice. He's that spirit rock. He's amazing. And I was like, I have an idea for like a digital version of meditation that uses a closed loop algorithm. And I was like holding my breath. He's like, I really like that idea. And so we worked on it together. And he's an author on our first paper. And so since we've last talked, we've had 3 publications on Metatrain and in great journals. Our first paper was in Nature Human Behavior on healthy young adults. We had a paper in Nature Translational Psychiatry that was published showing the benefits in children with mostly adolescents with adverse life events, and that was done in India. Both of those, and then we had a study showing really deep dive of what's happening in the brain. We have a third paper, a third randomized controlled trial in older adults showing the benefits as well. And what we see across all of these studies in common is that they all improved. This is just after 6 weeks of playing this game. Now, I don't want to say that this is magic meditation. It basically is meditation in the traditional concentrative breath focused meditation. Focus on your breath, be aware of where your mind and attention is. If you find your attention wandering, notice it, return it to your breath non-judgmentally. Pretty basic concentrative meditation instructions that you would get if you went on a meditation retreat like a Vipassana retreat. What makes this Metatrain unique is that you start with just having to do that for 10 seconds. And then at the end of 10 seconds, you get a cue. This is all done on an iPad or a phone. Were you successful? Did you focus on your breath or did your mind wander? It's actually interesting at the beginning. You're like, oh, what? You actually don't really understand where your mind is, nevertheless, whether or not you were successful at holding it. So it's like you're learning 2 things. One, you're learning to actually hold your attention to your breath. The other, you're learning to understand where your mind is focused. And what we find is that most people that are naive, that are not meditation practitioners, when you do this for half an hour, so if you say yes, I held my focus on my breath, then you get 14 seconds. If you say no, then you get 7 seconds. And so so that's the closed loop. You keep getting, as you can focus and notice that you are focusing without being interrupted by something either going on in your mind or something external that pulled your attention away, you get more time. If you fail, you get less time. And so it sort of thresholds you like a hearing test would do in terms of how long can you actually hold your attention to your breath without a distraction. And what we find is that most people that do this over the course of a half an hour wind up with just 10 to 15 seconds. That's it. After doing this for 6 weeks, most people are over 2 minutes. So you can build the skill to hold your attention to your breath through this practice, which, in its essence is essentially the same as many traditional concentrative meditation practices, whether the focus is your breath or a mantra or a body scan. The cool thing that we find in our research studies is that just doing that for 6 weeks leads to an improvement in attention when documented in a laboratory test of attention abilities, that people are able to sustain their attention in a very different environment when they're focusing their visual attention on a rare stimuli that's in a really boring task. So we show that in all these different populations. We recorded brain activity to show what is changing in the brain that allows you to have this better attention abilities after this meditation practice. And it's really, as we hypothesized, the networks and connectivity in the most evolved part of our brain, the prefrontal cortex, right up here, which allows you to direct your attention based on your goals, that its function and its connectivity is heightened after this practice. And most recently, this is unpublished data, so I'll frame it as such, but our newest study on older adults show not only did it improve attention, that's the third population that we show that in, but that it actually also improves their ability to regulate their stress responses, shown in the lab, and it actually also increases the telomere length, which is a cellular marker of aging, sort of caps on the end of your genes. And so, I mean, it's amazing. We're writing up that publication now. So take it for what it's worth, but hopefully it'll be out soon. But long story short, this is our own contribution from Neuroscape and Jack about how we can take these ancient practices and use digital technologies to deliver them in a way that's very accessible to people, because you sort of baby step into the process and show, and very careful, these are all placebo-controlled randomized trials, that we can lead to benefits, even now in some of our data, benefits that we show sustain a year later. So yes, we're excited about Metatrain because it fits with the story that we've been telling about the promise of digital technology to deliver experiences as medicine. But it also speaks to meditation in general, because it's essentially a traditional meditation practice, just delivered in a slightly different, more personalized way. And then I just want to be really clear here. This isn't what I just described to you as my own research contribution that we just have been publishing, but there is a large body of evidence from really impressive studies and researchers from around the world that contribute and converge on this same message, that this practice, which is work, like all of this is, of learning your mind, first of all. That was what was most salient to me when I was a participant in this study, is that I was like, not just learning how to hold my attention, I was learning where my attention was. I actually did not realize how unaware I was of where my attention was focused until I did this practice. So you learn what's going on in here, and then you learn how to control it based upon your own goals.
And I will add, I'll editorialize again. First of all, thank you, but I will editorialize that the ability to direct your attention toward your own goals is as wide ranging as it sounds. This
Mhm.
goes back to my sort of opening about attention. Like, if you wonder how valuable attention is, it's pretty much everything. So if you're interested in, if your goal is better mental health, and you can choose to direct your attention towards things that, even if it's toward the breath, and the result is that you can manage your stress responses better, and like that is basically equals mental health. You like it,
Undoubtedly.
yeah, and or
Or physical health,
yeah, or
or the
physical
quality of
health.
your relationships, or how safely you drive, or I mean, everything.
Yeah, literally everything.
Literally.
Performance. People, a lot of the people that are in this community want to be a better creator, want to understand their, that very inward journey about, tapping into the ability to learn from their experiences and share that with others in a meaningful way. Like, all this stuff
Yeah,
has at its foundation attention. And so
undoubtedly.
if you're wondering the role that attention can play in making your life better, you just heard it from here from
Yeah.
Dr.
May-
Adam.
Maybe if I could add one more
I
personal
would love
piece
it.
that I'm comfortable sharing, not as a scientist, but as a new dad. So I have a 20-month-old daughter. I'm pretty old dad. I'm 53 years old, but I want to be present with her, right? I want to be there, not just physically, but attentionally. And so it's been a really interesting journey over these last 20 months with her to, not just, talk the talk, which I just did, but to really walk it and really, really practice this presence and be with her as she develops. And I spend every morning with her. It's my dad job. I wake her up, or she wakes me up, and we spend the first, usually almost hour of the day together, the two of us. And not to bring my phone in the room, it's really tempting. I'm sure I have a lot of emails there. And really just be in the moment and appreciate and pay really careful attention to what's going on. And the reason I bring this up is because I learned something that I did not learn from my research, but sitting there with my daughter and trying to essentially have a mindfulness practice with her. I realized that even when I was paying attention to the moment, I was still often thinking about the future. I was often thinking about, man, when is she gonna like start speaking? Or why doesn't she walk as well as I wish she was walking right now? Or why when is she gonna get out of this like sort of behavioral state she is now of complaining a lot? And I realized that even though I was actually present and focusing on her, I was still not in the moment. And I caught myself and I was like, oh, this is not really the goal. The goal is to be fully here and not just be attentionally present, but to have gratitude for the moment. That was sort of the breakthrough that I had. I was like, just enjoy and be grateful to what is happening in the present. Don't just focus on your attention on the present, but feel gratitude in the moment. And that was a major paradigm shift for me personally when I recognized that attention was not just about focus at its highest level, or presence wasn't just about focus, but it was also about gratitude. And that really made my relationship even like move to the next level. So I'll just share that little personal
Oh,
experience.
I'm so grateful, and I love it. There's something as a human when, I imagine obviously at 20 months your daughter doesn't have the tools yet to express back to you,
Mm,
but we all do as adults. We have been paid what I'll call proper attention to before, and it feels different.
mhm,
If and this is the gift that my wife Kate has. If you are in her presence, she is like, and it is very, there's something incredibly special about truly having someone listen to you.
mhm,
And that is, I am making an extension now to my role here in this conversation.
mm,
I got better at this part of my life by just being able to be, and it's hard because you can't be thinking of the next question or the next point,
mhm,
or like it's very,
mhm.
very difficult. So
I can
the same
imagine.
challenges that, but I personally feel different. I can apply my attention in
Mm,
these
I
moments,
love it.
and it just makes for a better conversation. So
Mhm,
whether it's your 20-year-old daughter or our conversation, or again, I keep using my wife Kate as an example because she's just a super genius at this. It's a special thing, our attention, because it's all we have in
mhm,
this earth, on this planet.
mhm,
Last topic is this third circle, and I'm just going to call it just sort of general, the the abilities of the mind,
mm,
neuroplasticity,
mm,
the role that we play inputting into our mental health. And
mhm,
obviously you've already cited once in this conversation, we've just gone through a pandemic which was extremely challenging. We
mhm,
saw all kinds of mental health conditions on the rise. I'll say maybe even catastrophic. I don't know the definition of catastrophe or scientifically how you'd measure it, but it seemed like a lot of people that I knew were having a very tough time. So if you could help us understand that we have at our disposal this tool between our ears, and I consider it a tool because you
mhm,
can train it to work for you. And if you
mhm,
do not train it, it is not guaranteed to work for you because it is not there to keep you happy. It's there to keep you alive.
mhm,
So tell us the story that you apply to the potential
mhm.
of this thing between our ears, so people
Yeah,
can
it's great.
decide that they want to pay attention. Like, talk to us about the value of doing the work
Mhm.
between
Yeah,
our ears.
it's great. Great question. I'm excited to talk about it. It is what drives everything I do, whether, it's working with Achille, Neuroscape, advising for other companies, doing podcasts, giving talks. All of it is directed at this one goal of understanding how we can harness a fundamental property of how our brain works, which is called experience dependent neuroplasticity, in order to improve our function and improve our lives. That's everything. And the digital technology is like a really clever way of doing that. And it's timely and it's good. I think it could change the world. But if the brain did not change itself in response to experience, I would not be doing any of this. Like that is the foundational aspect of it. And I do want to point out that for a long time, for hundred years of neuroscience, we didn't really understand this property very well. We thought the brain did obviously change during development, but then it was pretty static or basically just declined the rest of our lives. And undoubtedly, all of our color of our hair, the density of, calcium in your bones, your brain. There's changes that occur with aging that are clear. But the capacity of your brain to improve its function through interactions with the environment, a property in neuroscience that we call experience-dependent neuroplasticity, is retained throughout our lives, and it is always available to everyone to lead to benefits. Now, that's sort of the foundational principle that I don't think any neuroscientist would disagree with. Where it gets complicated is, the devil's in the details. How do you do that? How accessible is that to people? Are the changes that occur meaningful? Are they enduring? That is really what I have been dedicating my life to, is to showing that we can translate, like, this is a term that we use in medicine and healthcare, and in my world a lot, translational medicine. But it's more like, almost uh like something that you strive for but no one really knows how to do. Like, you want to move it from the academic, from the intellectual exercise of understanding the brain, to an actual approach to improve our lives. If not, then why are we doing all of this? Like, it has to be a core goal, and it is my core goal, is to translate the fundamental neuroscientific principles of experience-dependent plasticity into approaches that actually have meaningful benefits in our lives. And that is a tall order, but that's essentially what I'm focused on. And how we do that, or how I do that, and my team at Neuroscape and Gazzaley and many other groups that I work with, is to use the properties of experience, the challenges, the rewards, the different type of sensory stimuli that are available, that are elements of experience, and figure out how to deliver them in a way that you can engage in deeply, that constantly challenge you, that lead to change, and then do the research and show that it actually does what you think it's going to do. That's like the two-part process. That's why what we do takes so long. We could spend 3 years developing Metatrain, because it's based upon all these principles of concentrated meditation, integrated with closed loop technologies, which we do, of reward and challenge adaptivity, and then be done. But no, then we do a 3-year research study and then publish it and show what it actually does. So that's the foundational approach, is to use the lessons from neuroscience that teach us what aspects of interaction, what aspects of experience are most meaningful, how do they vary from person to person, how could we deliver them in a way that leads to the change, and then show that it actually does what it does. So that's a big part of what I do. All those games that I talked about, from NeuroRacer, Beep Seeker, Coherence, Engage, Labyrinth, Rhythmicity, I mean, I didn't even Metatrain, I didn't even describe all of those. They're all built on the same approach. How to create what we call a closed loop. And this is an important part that I just want to pause on. I usually do this earlier, but a closed loop experience, which is like a term that is not frequently used, but one that I like to use. A closed loop experience is one where all the elements of the experience, what you see, hear, smell, feel, you're challenged, how the reward changes, are all being adapted based upon what is happening to you in the moment. Unlike a real world experience where that's not true. They're open loop, they're dissociated. Maybe you're influencing one thing in your environment, but most things are not being controlled. We create an experience where all the elements are built for you and changing with you as you change. And that's what all these games do, to some degree, not to the highest degree, not to where we're going now. Like, our newest experiments are taking this full science fiction, but how do we both understand what's happening to you in the moment? So, right, in order to create a closed loop, we have to know what's going on with you. How do we do that? Well, the easiest way to do it is just to use your devices, like what Achille does, where your accelerometer and your tap screen tell us how much you're paying attention, how fast you are, where your attention's directed. But we can also use multimodal biosensing, which is what we now do at Neuroscape, where we record hundreds of electrodes, hundreds of signals of data from throughout your body. We could take that and feed it back to you with a tablet or phone, because that makes a ton of sense, because everyone already has those and the need is so great, or in a full sensory immersive environment, which is also what we're creating at Neuroscape, where you see, hear, smell, and feel these rich environments that are changing as you change. That's the approach that we're taking to bring this experiential medicine conceptual basis to the next level. Now, all of this is a very complicated data cycle, essentially, because all this data from you is flowing into a processor, a computer processor, essentially, that's then making its own decisions about how to adjust all of these stimuli. And so that is the opportunity for machine learning and artificial intelligence to really both interpret in real time this very complex multimodal data set, and then to guide a multi-sensory experience and reward cycles that lead to these outcomes. That's what we're working on right now. That's the sort of the promise of using digital technologies, both on the recording and the sensory side, to drive experience dependent plasticity.
So foundationally, neuroplasticity is not just it's not something we casually throw around. It is known fact that your brain evolves and adapts biologically, neurochemically, in any,
Structurally,
yeah, structurally. It's like
everything.
that's bananas to me that your brain changes structurally on the fly.
It's changing
And
right now, structurally.
right. Okay. So here's the exclamation point, and I'm going to ask you to do something likely uncomfortable, because what I know about scientists in general, and you particularly, you're so careful. You choose your words very carefully. But how does this translate to the person who's sitting in traffic listening to this right now? How does it translate to someone who's on a walking path or at their desk at work right now? What do they do, or is it the hope? Because your work is so far into the future, and as you've articulated many times very eloquently, this is a long process, and the thing you started 13 years ago is just now hitting the street. But is there advice, and this is where you're going to get comfortable, that what advice do you give for someone who's paying
Yeah.
attention? Is it do what you
Uh,
can with what you have? Is it meditate? Is it
yeah.
stand by for cool stuff coming down the like
Yeah.
what's the
I
call to
feel
action?
I feel less uncomfortable about this now because I have an approach to dealing with this question, is that
Oh, good.
I'm not like a self-help guru type guy, right? I'm not gonna tell you like these are the 6 steps to live a better life. I'm never doing that. And it's just not what I do or what I feel comfortable doing. But I can tell you about what I do. So, I am a person, not just a scientist, that has a life and a family. I am completely in love with, like, I have, the new iPhone and the new AirPods. Like, I love technology. I use it all. I'm on social media. Like, I'm not like living on some mountaintop. I am here with everyone else, as susceptible to all of the pulls of my attention as everyone else is. But I have, certainly adapted my life in the moment, not just waiting for all the cool things that we're creating, because who wants to wait, right? I mean, life is happening right now. We've been talking about that. Everyone has their job, their families, their goals right now. And I really believe that we will produce amazing tools to help people. And that's what we're doing, but it's hard work. And we're only going to do it one way, completely rigorous. That's the only way that we're going to do it. And you'll get it, but it's going to take a while. That's true. But all of the things I talked about are accessible, maybe just not as accessible as we will make them, but to people to bring into their daily lives and their practices. I mean, the first thing is just being aware of where your mind is, where your attention is, having an appreciation for the fact that if you're not controlling your attention, it's likely someone else is, and that if you can't control it, the consequences are broad, and recognize what they are. So like step one is just meta awareness, understanding you and your brain and your mind and how it interacts with the world around it. What are you doing that you don't like doing, that you're not, maybe not even aware of? Are you allowing technology to control you and not you control it? Because that's a major problem, right? And so step one is awareness, and just trying to wrap your head around how you want to live. Step two is harder than that. Even it's because someone's like, I don't want to smoke anymore, I want to work out more, I don't want to eat unhealthy food, I want to stop smoking. It's like, okay, accomplishing that is far from trivial, and I don't mean to diminish how much work it is, but step one is to know that you want to change and that you recognize the value of attention and all these things we're talking about. But, number two is finding either practices, whether it's physical fitness, which shows a lot of benefit from the research, meditation practices, just slowing down and pausing, changing your behaviors through new habit formation. So, and again, these are not advice that I'm giving. This is what I practice and have worked on myself, sometimes successfully, sometimes less successfully. But, like when you're really doing something that's important, and that might be you're writing something or doing something at work, or maybe it's just a conversation, or maybe it's just being there with your daughter, like try to do one thing at a time. It's really hard to do one thing at a time when you're in the habit of doing multiple things. But if you practice it, you will get better at it and it will get more enjoyable. Right? Like the first day, like you said, I want to run a marathon, like it's going to suck, right? It's not easy, but somehow over time, even what is once punishing and unacceptable becomes enjoyable. It's the same thing with single tasking. Like if you get in the practice of doing it and really being present, you will struggle, but then you will hit a moment where you're like, oh, that feels good also. And then it becomes more sustainable. So, that's all the things that I try to bring into my life. And it's definitely has improved my life. So, we're speaking in a lot of futuristic terms here, because that's my job, is to build the future. That's what I try to do. But every one of these things can be accomplished in daily life if you try and really have the intentions of bringing them into your life.
Hmm. It is always a treat. You are so articulate, and an hour of your time is like it's like dog years, right? It's like worth seven normal podcasts right there of density and hope and practical applications, and just I'll again, another double entendre, just the awareness of what's possible with this one precious life that we have. So thank you so much. Congratulations on
Thanks,
Achilles
Chase.
going public. Are there, and again, on your lab, or former lab now, that it's a, what did you say? It's a
Center.
department?
Yeah, it's a
Center.
research
Wow.
center, Neuroscape. Yeah.
Wow.
Yeah. We have like 45 people, 10 faculty. It's a big group.
Wow. How things can change in just a few years. Congratulations. Is there anywhere you would like to direct our audience's attention, aside from all of the topics we've been talking about? How can they learn more about you, or where would you point them?
Yeah, well, I created a website during COVID called Gazzaley.com. My name is very rare. I was able to actually get it as a URL, and essentially it's like an aggregator of, Neuroscape, Achilles, other projects I work on, my photography. I'm a nature photographer as well. That's a commonality between Chase and I. And so that's a good place. If you want to be more direct, Neuroscape has its own website. You could go there, neuroscape.ucsf.edu. That's the whole research center. And then AchillesInteractive.com to learn about Achilles. But there's also links on my site if you wanted to start there. And yeah, our publications are up there. This podcast will be up there. I try to share both the scientific content as well as, great conversations like we're having, where I get to like sort of break it all down. So I thank you also for giving me the opportunity to talk about this and create questions. And I actually really enjoyed this. So thank you.
Awesome. And for those wondering, Gazzaley is Gazzaley. Am I right on that one?
You are correct.
Memory. Okay,
that's
good.
it. Yeah.
Could you imagine if I misspelled that? We would have to re-record that.
That's it.
Thanks again, friend. It's a treat to spend time with you. And to everyone out there in the world, you heard it from Dr. Adam, where you can go to learn more. It would also be valuable to go back and listen to our previous episode where he talked about the book, The Distracted Mind. Also incredibly valuable, but do dive deeper into this, and what an inspiring future we have. There's so much potential. Now we just got to get our shit together. Thanks again, Adam. I appreciate you. And to everybody out there in the world, signing off from yours truly and Dr. Gazzaley. Until next time, we bid you adieu.